Welcome to the Does This Happen to You podcast, where we explore the funny side of truth is stranger than fiction stories. Our story this week is from Michael Berg, MD, who you'll find on medium.com. And here is Diagnosing the Cause of My Headaches and What That Taught Me, a Weird Medical Journey. Heartaches over headaches. In 1967, as a 12-year-old, I began experiencing blinding headaches daily. My parents weren't much for doctors, thinking, rightly so, that most stuff either wasn't serious or would go away on its own. Plus, our family was borderline poor. Not poor exactly, but we ate a lot of hamburgers, spaghetti, and not a lot of steaks, unless the Sizzler restaurant featured their 89-cent dinner special. Even then, I didn't think steak was on the menu. I'm pretty sure that, at one point, Sizzler sizzled and served me up a cow kneecap as the main course. My mom described us as lower middle class, at least when my hard-working dad wasn't within earshot. Bottom line, not a lot of unnecessary trips were made to our family doctor. Eventually, though, my bitching and moaning about my nonstop headaches reached my parents' ears, and off to the doctor we went. And so began a marathon medical merry-go-round. We started with the family doctor, which is what everyone, or at least everyone we knew, did. Dr. Schnitzenfarfel examined me from head to toe and asked me and my mom and dad a shit ton of questions, none of which led him to a diagnosis. Then the real fun began, with still more trips to various specialists and for various tests. I recall seeing a neurologist who was just as stumped as my family doc, but who did recommend some sort of head imaging and a spinal tap, medically known as a lumbar puncture. Advanced imaging techniques like CAT scans, computed axial tomography, and MRIs, magnetic resonance imaging, were far in the future of medical care. I recall having some garden variety skull x-rays done, but I really don't remember the details. These, quite predictably, showed nothing. Well, not exactly nothing, but nothing helpful. Just bright white where my normal skull and facial bones were, and unrevealing gray everywhere else. The spinal tap details I do remember in lurid detail. After being asked to lay on my side and curl up tight like a little pill bug, the neurotorturologist swabbed my toasty warm lower back with some glacial antiseptic solution, then began sticking the area with needles, all the while commanding me to stop squirming. I did my best, but it was brutal. I still recall the scrape, scrape, scrape feeling of the extra long, extra stiff, extra wide spinal needle as it bounced off my vertebrae while the doctor struggled to find a path to a few drops of my cerebral spinal fluid, the fluid that surrounds the brain and spinal cord. Find it he did eventually, but the experience was far from freaking fun, especially for me. After the procedure, I was released from the poker's presence and told to go home and rest in bed. This is to prevent a so-called post-spinal tap headache. Rest I did, for a bit, but resting made my pre-existing headache worse, so in a burst of 12-year-old brilliance, I got up and went outside to play, and promptly developed a post-spinal tap headache on top of my already kicking my ass headache. Then I went inside and cried myself to sleep. The results of the spinal tap were stone-cold normal, and the neurologist, brainy brain master that he was done with me. On to psychiatry. Talk about questions, and talk about questions that produce no answers. I did get to explore my feelings about everything from soup to nuts and back again, and my mom and dad, and being bullied at school, and so on and so forth, and up and down and back and forth. But you guessed it, no diagnosis was forthcoming. I was rapidly becoming a pesky 12-year-old with a pesky problem that no one in medicine wanted a part of. So, back I went. To where all unsolvable problems went in those days, back to the family doctor. The person who got saddled with all the dross no one else in medicine wanted to deal with. An answer emerges, clear as the nose on your face. For some reason, on this visit, the family doctor's nurse led me down a short hallway with a strip of yellow tape on the floor and had me pause at the yellow tape. Then she called out from about 20 feet away, "Read the eye chart. Start with the big E at the top, and if you can't tell me the letters, just tell me which way the legs of the E are pointing." She must have thought I was some kind of cretin since she treated me like I was 12 days old, not 12 years old. Geez. My response to the nurse's instruction to read the eye chart was, "What eye chart?" A hurried, murmured nurse-doctor hallway confab ensued. Then the doctor spoke to me, my mom, and my dad. "Your son is as blind as the proverbial bat," he said to my parents, or some such statement, but in medical terms. "His lancinating daily headaches are almost certainly due to eye strain. He needs glasses." Off to the eyeglasses doctor we went, and sure enough, once my world came into focus, my headaches abated. I reverted to being a normal 12-year-old dweeb, although a bit dweebier than before because I had big, old, black-rimmed specs with lenses exquisitely capable of focusing the sun's rays to grill meat. Aha! It turns out all the medical poking and prodding and picture-taking could have been avoided if someone, at the get-go, had thought to check the basics like, "Can you see?" My experience was the medical equivalent of puzzling over the cause of someone's back pain while ignoring the spear sticking out of their scapula, the angel wing bone in the upper back. Some questions, no real answers. A question or two arises organically from all this. Why did anyone not see that I couldn't see? Why did I not see that I couldn't see? I can only posit that my diminished visual acuity happened gradually, and I'd adjusted to it. I still remember sitting in the front row of every class, especially as a 12-year-old. My teachers liked me, and I was a good student, but not that much, and not that good. In retrospect, my front row positioning had less to do with school popularity or performance, and everything to do with being able to see the chalkboard. So, teachers and my parents didn't know I couldn't see worth a damn. They just thought I was being a good little suck-up. Why didn't I notice my gradual vision decline? Who TF knows, really? I remember thinking that maybe a blurry world was what everyone saw. I didn't have the wit to question it. That's some keen 12-year-old reasoning. I dealt with my failing vision just like my parents dealt with most medical problems, by ignoring them until they disappeared. More fun. As an aside, the keenness of my medical reasoning was tested again a year or so later when I developed a groin rash, jock itch. Rather than bring it to anyone's attention and get treatment and relief, I worked myself up into an isolated frenzy by convincing my idiot self that I had a sexually transmitted disease. This is even though I'd never had sex and barely even knew what sex was. A life lesson. What lesson did I learn from my headache experience? Consider the obvious cause of a problem first, and then, and only then, if that's not satisfactory, proceed to other, more involved ways of thinking about the problem. Remember the guy with a spear in his back? That's probably the cause of his back pain, although it is plausible that he also has lumbago. This simple-minded approach served me and my patients very well during my 30-plus year career as an ER doctor. One last example. I still remember a middle-aged female patient shrieking, "I'm having a heart attack!" She so inflamed the environment that about 10 panicked emergency department coworkers rushed to her aid. I kept my distance, watching, making sure the patient wasn't dying, and happy that a horde of professionals, panicked though they were doing all the right stuff, hooking her up to monitors, starting IVs, doing tests, and generally bustling around with adding too much to the mayhem. All the while, my patient shrieked as though she was being gnawed on and dragged through the gates of Hades by Cerberus himself. I'd seen some heart attack patients, and everyone reacted to the event and to the pain differently. However, no one had ever shrieked, "I'm having a heart attack." They may have moaned, sweated, puked, and clutched their chests, but shrieking was not part of the festivities, not in my experience. So, when the dust had settled, and I could find my way through the knot of my co-workers surrounding the still shrieking patient, I approached, calmly introduced myself, placed my hand on the patient's shoulder, looked deeply into her eyes, and asked one question. "When did your chest pain start?" Drawing a deep breath and stilling her shrieking for a moment, my patient replied, "Right after I put on this bra," nodding downward at a massive black bra with double D deep cups. "Take off your bra," I said. She did. A black widow spider, big as a quarter, which had been biting her boob while trapped in her left bra cup, darted out onto the patient's bedsheets. I squished it. My patient's chest pain abated, with the help of a touch of morphine a short while later. We stopped searching for other weird and wonderful causes of her symptoms. Obviously. Thanks for listening. I'm Chris Kepler, and I hope you enjoyed listening to these stories as much as I enjoyed narrating them. I'd love for more people to hear these wonderful stories, so please share and tell your friends.